Hi, I'm Dr. Irshad. I'd like to welcome you to the Eye Clinic of Austin, where we're excited about working with you to do your cataract surgery. At Eye Clinic of Austin, we believe in personalizing your results and your eye care, where we want to talk to you about what your individual needs are so we can better prepare you for cataract surgery and walk you through exactly what we're doing, how we're doing it, and what you can expect. So to give you a brief introduction about cataract surgery, generally speaking, it's about a 15-minute procedure. We numb your eyes the same way that we do here in the office using some eye drops. We don't need to put you to sleep or use general anesthesia. Instead, we use IV sedation or some medications to help you relax and make you a little bit sleepy. We do need some of your cooperation in order to make sure you can follow some simple directions during the procedure. Most people don't remember everything from the cataract surgery, and all you feel is some pressure, some cold water, and you see a lot of bright lights. After we're finished with the surgery, we see you for about 20 minutes, and then you're on your way home. After cataract surgery, we do need you to use some drops, typically 4 times a day, and we need to see you back the next day as well as the following week. Whenever we do cataract surgery, we do one eye at a time, and generally we'll wait about 2 to 3 weeks in between the eyes. It's important to remember that cataract surgery doesn't hurt. At Eye Clinic of Austin, we believe in delivering the most precise surgical outcomes, and we do that using a variety of technology. We have different lasers that can do the surgery and help with the calculations during the surgery as well. I want to take a moment to explain to you exactly what cataracts are, why you have them, and explain to you what we can do about them. If we take a look at some of these pictures, we can explain it in a way that's easier to understand. We're looking at this part of your eye right here called the lens. The lens is nice and clear when you're first born. However, the problem is the lens is the only part of your eye to grow as you grow. And so over time, what happens is that your lens accumulates a lot of dead cells, water, and proteins on the inside. And as that happens, the lens becomes much more cloudy, white, and opaque. It's no longer crystal clear like it used to be. Typically at night, when your pupils dilate and get bigger, more light enters your eye, and because of the cataract, more light scatters inside of your eye, giving you more glare and sometimes starbursts or halos, making it much more difficult to drive at night. The only way to fix cataracts is by doing cataract surgery. There's no drops or medications that can cure them. When we do cataract surgery, there are 2 ways to disassemble your cataract. The older method is called phacoemulsification. It involves using sound waves on a needle to break apart your cataract. The small needle enters your eye through a very small incision, and the needle vibrates so quickly it uses sound waves to break apart your cataract, similar to the way that dentists clean your teeth and remove the plaque. There's a newer method to doing cataract surgery, which involves laser technology. The laser is newer, and we've been doing it for the past several years. Unlike the ultrasound, the laser will scan your eye. It has the ability to tell us where the cataract is and tell us exactly where it's located and see how dense your cataract is, so it can customize your cataract surgery. The laser takes just a few seconds to do your surgery, where it can send a beam of energy through your eye to help disassemble your cataract. With the laser, we often don't have to use any blades to enter your eye, and it's considered a bladeless procedure. The laser also has the unique ability to help reshape your eye and help treat some, but not all, of your astigmatism, giving you even better vision. Sometimes with the laser, we've noticed that you may have a quicker recovery, especially if you have more dense cataracts. We utilize either the laser or the ultrasound method to remove your cataracts. And once we've removed your cataracts, we then need to place a lens implant in your eye to help take the place of your cataract to try to help you see better. When it comes time to put the lens implant in your eye, we have several different choices. There are 3 different types of lens options you should be aware of, and I'd like to walk you through the different types of lenses we have available. For the choices of the intraocular lens implant, we have the basic standard lens implant, which looks similar to this. It's nice and clear, giving you better overall distance vision. Oftentimes, with this standard lens implant, you have better vision, but you still need to wear spectacles to correct your vision for distance, and you certainly need glasses to help you see better up close and perhaps even the computer or your intermediate vision. The second lens implant and the second choice is a toric lens that looks similar to this. It's designed to help correct your astigmatism from the inside of your eye, giving you even better distance vision. With this lens, you may be able to drive and watch TV and do a lot of things around home without glasses. However, you will still need glasses to read and to use the computer. The third lens option is considered a multifocal lens or an extended depth of focus lens. There are several names for this type of lens, such as Restore, Symphony, Panoptics. This lens is essentially designed to help give you a range of vision. With these rings, you're able to have good distance vision, intermediate vision, and near vision. The near vision is designed to help you read bigger print items, but if you're trying to read the phone book or the ingredients on the back of a bottle or a recipe book, things with fine print, you may still need reading glasses even with a multifocal or extended depth of focus lens. This type of multifocal or extended depth of focus lens does have limitations. For example, at night with this type of lens technology, you may see some glare, you may have some halos or starburst. Most people don't notice them, but you may be able to see them. They usually go away and fade away with time. That's especially true after your second eye is done and has the same lens technology, but at first most people do see them. Most of our patients explain that it's worth the trade-off of having this type of lens technology and having a range of vision versus seeing some of those nighttime symptoms. Also, these multifocal type lenses can affect your contrast and your contrast sensitivity, but once again, that's difficult for most of our patients to notice. Regardless of which lens you choose to consider for your cataract surgery, we want to work hard and partner with you in delivering the best visual outcomes. Cataract surgery has risks and benefits similar to any surgery. It's important to note that at this point we've determined the benefits of cataract surgery outweigh the risks of cataract surgery. The benefits of cataract surgery include improved vision and better visual quality, reduced glare at night. The risks of cataract surgery are rare. They can include, but are not limited to, changes in vision, changes in eye pressure. There's always a risk of bleeding, swelling, scarring, infection, inflammation, a retinal tear, hole, or detachment. Sometimes we're unable to remove all of your cataract at once, and sometimes the lens implant that we put in your eye could be of the wrong power or may be out of position. All of these risks are extremely rare, but they could happen, and it's important to be aware of them. Usually, most of these risks can be corrected later on if needed. So now let's talk about the day that you'll be having your cataract surgery and what to expect. You'll check in at the surgery center and we'll need to dilate your eyes. We'll start an IV, we'll talk to you about your history, your medications. Pretty soon we'll be calling you back to surgery. If you're doing the laser treatment, then we'll do the laser treatment at the beginning. You may feel some pressure on your eye as we dock the laser to attach it to your eye in order to do your scans. This pressure, when we start cataract surgery with the laser treatment, you may feel a little bit of pressure in and around your eye. It's just like someone giving you a tight hug. It's nothing that is painful or too sharp. And it's something that most people never remember. The laser takes just a few seconds to work. The average treatment with the laser lasts only about 30 seconds. Once we've done the laser treatment, we then go into the second room, and that's where we are removing the rest of the cataract, cleaning everything else up, and putting the lens inside your eye to help you see better. Oftentimes, we'll use the Aura device, which is another laser, in order to recalculate the measurements that are needed to place a lens inside your eye. These measurements are often more useful because at this point in time, the cataract has actually been removed out of your eye, and this is done in real time during your cataract surgery. Once the surgery is finished, we'll bring you back to the postoperative area where we'll ask you how you're feeling and get you something to eat and drink. We'll monitor your symptoms and you should be going home within just a few minutes. For most patients, the recovery after cataract surgery is just a few days, sometimes as quick as 1 or 2 days. During the first few days, we ask you not to lift anything heavier than say 10 pounds off the ground, not to go swimming, and just keep your eyes clean. We will need you to wear a clear eye shield only at night when you're sleeping and use eye drops a few times a day, starting the day of your surgery. We will need to see you back in our office the next day as well as the following week to make sure everything is going fine. Most people are okay to travel the week following their cataract surgery. If needed, we can give you a new spectacle correction and refraction about 3 to 4 weeks after your initial cataract surgery. Cataract surgery is not a very painful procedure. We give you numbing eye drops so that you don't feel anything, and we give you IV medication to help you relax and help you be a little sleepy. Again, most patients don't remember much about their cataract surgery and certainly don't have any pain. A few other key points to remember about cataract surgery is that 1, you may develop some scar tissue behind and around the lens following your cataract surgery. This is a very normal and natural process called posterior capsular opacification. It's the buildup of protein as your eye heals. For some patients, it happens a few weeks after cataract surgery, and for others, it may not happen for a few years until after cataract surgery. When and if it happens, and if it affects your vision, we can do a laser in our office to help remove the scar tissue. That treatment usually only takes a few seconds and is typically covered by insurance. After this procedure, usually no drops are required and there's no pain involved typically. Cataract surgery only needs to be done one time and it never needs to be repeated. The lens implant that we place in your eye is permanent and it will last the rest of your life.